Hello and welcome to the module Norovirus, the Basics, a frontline forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about norovirus. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Norovirus, the Basics, is the first of a two-part series exploring norovirus. You are viewing the first module of the series. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you should be able to describe the frequency and causes of norovirus, identify the signs and symptoms of norovirus, and describe how norovirus is spread. So, what is norovirus? Norovirus is a very contagious virus that causes vomiting and diarrhea. Anyone can get infected and sick with norovirus. Norovirus is sometimes called the stomach flu or stomach bug. However, norovirus illness is not related to the flu, which is caused by influenza virus. Norovirus is the leading cause of vomiting and diarrhea and foodborne illness in the United States. People of all ages can get infected and sick with norovirus, which spreads very easily and quickly. Norovirus causes approximately 21 million illnesses each year. It is the leading cause of illness and outbreaks related to food in the United States. Symptoms start between 12 to 48 hours after being exposed and can last from 1 to 3 days. Signs and symptoms of norovirus infection may start suddenly and include nausea, vomiting, stomach pain or cramps, watery or loose diarrhea, feeling ill, low-grade fever, and muscle pain. Signs and symptoms usually begin 12 to 48 hours after your first exposure to a norovirus and last 1 to 3 days. You can continue to shed virus in your stool for several weeks after recovery. This shedding can last weeks to months if you have another medical condition. Reporting a change in condition is an essential component of prevention and/or prompt treatment for any disease, so be sure to notify licensed staff immediately if a resident or patient has any of these symptoms. Norovirus spreads easily and quickly. It only takes a very small amount of norovirus particles, fewer than 100, to make you sick. People with norovirus illness shed billions of virus particles in their stool and vomit and can easily infect others. You are contagious from the moment you begin feeling sick and for the first few days after recovery. Norovirus can spread quickly in enclosed places like nursing homes and assisted living facilities. Norovirus can stay on objects and surfaces and infect people for days or weeks. Norovirus can be resistant to some cleaning disinfectants, making it hard to get rid of. The virus is shed in stool and vomit. You can spread the virus from the time you first have symptoms of illness until several days after you recover. Norovirus can be spread in multiple ways, including via food and drinking water. Food may become contaminated if individuals infected with the virus have handled the food. Food can also become contaminated if it has come into contact with soil or water containing the virus. Drinking water may become contaminated if there is well contamination from the septic tank or chlorination system breakdown. Food or water can be easily contaminated by norovirus, and numerous outbreaks are attributed to improper handling of food by infected food handlers or through contaminated water sources where food is grown or cultivated. In healthcare, the most likely and common way in which norovirus is spread is through direct contact with infected persons or contaminated equipment. In healthcare settings, norovirus may be introduced through ill patients, visitors, or staff. Examples of person-to-person transmission include direct fecal-oral, ingestion of vomitous particles suspended in the air, indirect via objects or contaminated environment, and exposure to norovirus from vomiting persons. Norovirus can also spread through contaminated objects. Contact with a contaminated surface or object can occur if touching your hand to your mouth after your hand has been in contact with a contaminated surface or object. Remember, noroviruses can stay on surfaces and objects for days or weeks. Noroviruses are difficult to kill because they can withstand hot and cold temperatures and many disinfectants. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Norovirus Basics Quiz on the Frontline Forces webpage or in the YouTube description below.